Hi, my name is Kate Sullivan, and I'm here representing the Medical Advisory Board of the Immune Deficiency Foundation with some information on the coronavirus outbreak, the coronavirus that is now known as COVID-19. There are 4 parts to this short video designed to give you some practical information. So first I'll give you an update as of March 3rd, 2020. Then I will talk about how to prevent infection for yourself. I will talk about some logistics, and these are taken from National Public Radio. And then I will talk about what to do if you get sick. And at the very end, I have some resources if you want to get some further information. So in this first section, I will just give you an update on the coronavirus. So this coronavirus has now been named COVID-19. It is a virus, it's not a bacteria, so antibiotics will not work. Where did this virus come from? It's not entirely clear, but right now people think that it circulated in bats in China for some period of time. And then in the fall of 2019, it first infected people, and now the major transmission of this virus is person-to-person transmission through respiratory droplets. What does an infection look like? It typically has consisted of fever, cough, and in the severe cases, shortness of breath. Now, where will this virus hit? It is pretty unpredictable. At the end, I will give you a website where you can check the most recent maps for both international and within the U.S., the current state of the spread of the virus. As of today, it is on both coasts of the United States, and if past epidemics of influenza are any guide, it will shortly be throughout the United States within a month or 2. In addition, although there are lots of international efforts to contain the virus, it does appear relatively widely spread, and it's unlikely that we will be able to prevent its spread throughout the rest of the world. So that's the bad news. There is some better news. The better news is the more we know about it, the less severe it appears. So initially, only the most severely affected patients were identified. Now it appears that there are lots of people who have minimal symptoms where it's really nothing more than a cold. You will no doubt have heard on television a lot of discussion about the case fatality rate. In fact, we won't know for another few months what the true case fatality rate is. Right now, it is being cited as between 1 and 2%. And just for some perspective, that is higher than influenza, which is usually about 0.1%. However, as I said, the more we learn about the virus, the more we learn that there are lots of people with relatively minor symptoms. Along the way, and particularly from our colleagues in China, we have learned that there are some high-risk groups. So the predominant risk factor for severe disease is age. So those over 60 have an increased rate of severe disease, and those over 80 have an even higher rate of severe disease. In China, they have also identified some additional health conditions that are associated with more severe disease. The one that has been spoken of most frequently is diabetes. Immune deficiency has not yet been called out as a particular risk category for severe disease. However, again, our experience with other viruses is that immune deficiency is likely to cause some increase in severity, although it may be different across different diagnoses. So I just want to say a word or two about how respiratory viruses spread in general, because I think it comes as a surprise to people that it's not about being coughed on, it's not about the droplets landing on your face or going up your nose from someone who's actively coughing, although to be sure, that is a significant source of infection. But probably more people get respiratory viruses by touching something that has virus on it and then rubbing their face. And so a lot of what I'm going to talk about is changing our own behavior to minimize that phenomenon. So a lot of the behavioral changes that I'm going to recommend are really interrupting that cycle of touching something, a person, a doorknob, a hand railing, and then rubbing your face, itching your nose, something like that. know it's very hard, so I suggest we all start now. So the easy thing is shaking hands. Unless it's absolutely required in your workplace for etiquette, I would suggest an elbow bump or a very respectful bow. You don't have to shake hands necessarily to demonstrate respect. If shaking hands is absolutely required, please go ahead. I don't want anyone to lose their job. But be mindful now that there is likely something on your hands that you could then put on your face. Well, what about touching your face? So it is just human nature. Everyone touches their face hundreds of times a day. So one thing to do is to try putting on large glasses. So if you don't normally wear glasses, put on a large pair of sunglasses and just notice how often you are sort of pushing it to one side to rub your eyes. Notice how often you touch your face. I guarantee it will be more than you think. So this has to stop. And so what I suggest is that if you have an itch on your face and you just have to do it, grab a tissue and use the tissue to rub your eye, itch your nose, whatever is needed. Use the tissue, not your hand. So what about those hands? So you want to wash your hands all the time. And remember, adequate hand washing with soap and water takes 30 seconds. That's a lot of soap. Don't forget your thumbs. There's a lot of stuff that doesn't get cleaned off of thumbs. So hand washing requires a lot of soap, warm water, and 30 seconds of sudsing your hands. That's one chorus of Happy Birthday to You or one run through the ABC song. It's longer than you think. So to be really adequate with soap and water, you have to really commit, and it's not always that easy to do if you're busy at work, interacting with clients, or at school. So the alternative is Purell or some alcohol gel. The alcohol gels must have at least 60% alcohol. This is not the time to try and figure out if some lemon-scented salve can be the same thing. You really want to be sure you're killing the virus. And so use an alcohol gel that is at least 60% alcohol. And the way it works is by drying. So I've seen people put alcohol gel on their hands and then wipe it off. You really need for that alcohol gel to dry on your hands to kill things. Does it kill everything? No, soap and water is still better, but the accessibility of alcohol gel makes it a lot more useful in your everyday circumstance. So just tuck a little bit into your pocket. They make little bottles that are really reasonable to carry around. So always carry some with you. Everyone has been talking about masks, so let me also talk about masks. You may say, why not? Why won't this help me? I want a mask. And so here is why. These masks are designed for surgeons. They're designed to ensure that a surgeon doesn't spit or cough or sneeze or otherwise spread particles into the surgical field. They are not designed to prevent stuff from getting in. And in fact, I'm going to put this on in a minute. What you will notice is that my breath is actually coming in through the sides and under through the bottom. It doesn't actually go through the paper filter here. And so you're not actually doing much when you put on a face mask, and that's why you're hearing that it doesn't prevent the coronavirus. And in fact, because most people are uncomfortable wearing masks, they probably touch their face quite a bit, and then that represents a potential for infection. I'll just pop this on for a minute. And you will notice that there's all this gap, and that's where the air is coming. The air is not going through the filter. So the masks don't work, and please don't waste your money on them. First thing is to just think about alternatives. So maybe this is not the time to get on an airplane and go somewhere. Maybe you could have a meeting that is web-based, or you could have a digital conference. Maybe there are opportunities to modify the times that you need to be in large groups of people. So that's number one. Schools are looking into modifying some of their lessons and whether lessons could be broadcast so that kids can stay home. And then the last tip from the NPR article is the same that you have been hearing forever and ever. Always have 2 weeks of food, water, and medications at home. This is good advice for tornadoes, hurricanes, earthquakes, all natural disasters. It is especially good advice now. If there is a quarantine of your city or your building, those quarantines have been lasting 2 weeks. So you want to have 2 weeks of food, water, and all medications that you can imagine, and maybe some entertainment. It's no fun to be quarantined. So 2 weeks worth of things in your house so that you don't have to go outside. And the last section I want to address is what to do if you get sick. What happens if you get a fever or a cough in these uncertain times? So first of all, do not go to the hospital. You do not want to be surrounded in a waiting room with people who might have COVID-19. So if you have a cough or a fever, unless your doctor has told you otherwise, and certainly there are some people where doctors would want to see them for every fever. So unless your doctor has told you otherwise, if you have a cough or a fever, stay home. Use the usual treatments that you have. Make generous use of inhalers if you have been prescribed inhalers, and stay home and see how it goes. Again, most cases of the coronavirus are going to be mild. You do yourself no favor by going to the emergency room. Maybe you just have a simple cold, but you go to the emergency room and there you are infected with the coronavirus. So do stay home unless your doctor tells you otherwise. The other thing I would say is that even in the hospital, the medications that are being used are supportive and symptomatic. Remember, antibiotics don't work. As of right now, there are no antivirals. So the care that is being given in the hospital, in the urgent care centers, in the emergency room is not markedly different than what you can do at home. The exception being, if you develop shortness of breath and you cannot manage it at home, or you have another symptom where you cannot manage it at home, then you would want to alert your doctor and possibly go to the hospital. So I'm going to end. I hope this has been useful. I am going to leave at the end of this video some resources. The World Health Organization has an update every single day with international maps. The CDC has an update with US maps. And then there is a lovely video about how far sneezes travel that I think is just a useful thing to see in this time in particular.